Good morning, everybody. Sincere apologies for the problems that we've had this morning with running this national event. There have been severe glitches in the system for a number of issues, including the link. We are going to start from the beginning again and try and bring you the whole event, which will be recorded. And if there are any more problems with it, what we will do is that we will reschedule it for another time. But thank you very much for bearing with us. And we hope that this time that it will work fine. Okay. Can somebody in the HRB team confirm that we're okay to go?
We're good to go.
Brilliant. Thank you very much, Maura. Welcome again to those of you who joined us early, and welcome to those people who are just logging on at the moment. This is the Irish launch of the Horizon Europe Health Cluster. I'm Dr. Patricia Clark from the Health Research Board, and I cover the National Delegate role for Horizon Europe Health, representing Ireland on the Health Programme Committee in Brussels. And I'll bring you through our agenda for the next 2 hours. Many of the greatest health challenges we face are global and can only be addressed through international and EU partnerships. To meet these challenges, the HRB and the wider Horizon Europe Health team is committed to fostering and enhancing European and international coordination, collaboration and engagement in health research. The HRB itself, my own organisation, has played a key role in Europe. In Horizon Europe, we will provide the national delegate role and 1 of 2 national contact point roles. We will work as part of the HRB team, the health team, with our national contact point in Horizon in Enterprise Ireland, and as a part of the broader national support network with players from many other agencies and departments in Ireland. We see that the National Health Research Agenda aligns closely with the Horizon Europe agenda, and we will continue to work to build on our experience of providing insight and national support across EU programmes, including the EU framework programmes, Horizon Europe, but also the EU Public Health Programme, EU for Health. We will support our engagement in new EU partnerships, for example, the Transforming Health and Care Systems. We will develop our ongoing involvement in EU co-funded initiatives across a range of health areas, including AMR, healthy lifestyle, neurodegenerative diseases, rare diseases, personalised medicine. We will reinforce our ongoing involvement with global partners in COVID-19 related international clinical trials and networks. And we will reach into current policy areas such as the digitalisation of healthcare and the associated development of the European Health Data Space and the Europe Beating Cancer Plan. This is the beginning of a new conversation, a new EU programme for the next 7 years, with new opportunities, new budgets, and with a renewed energy. This morning, we will bring you the voices from the HRB Enterprise Ireland Health Team for Horizon Europe, the Department of Health, the EU Commission, and a small sample of those who have experience of researching successfully on the European stage. Some housekeeping before we start proceedings. Submit your questions using the Q&A function. Please keep them short and specify who you want to direct it to, and we will come to questions after the Q&A panel. We have had severe technical difficulties this morning, but if you need any further help, please contact our host using the Q&A function and they'll message you privately. Just to reconfirm, the event will be recorded and we will make it available on HRB YouTube's page in coming days. And the health team is available to talk to you directly, either at individual meetings or team meetings over the coming years. I'm delighted to start our meeting with a message from the Minister for Health, Stephen Donnelly. The Sláinte Care Implementation Strategy, the government's agreed roadmap, a 10-year programme to transform Ireland's health and social care services, provides a roadmap for building a world-class health and social care services for people in Ireland. Research, evidence and data were identified as critical enablers for healthcare reform and sustainability of the healthcare system. So we're delighted to bring you this message of support from the Minister for Health.
It's my pleasure to join you today to launch the Horizon Europe Health Programme, supported by the Health Research Board and Enterprise Ireland. Health, obviously, is at the forefront of people's minds, and the importance of research has never featured more prominently than it does now in the context of COVID-19. As part of the Irish health research community, you now have a fantastic opportunity to participate in the wider European research effort through Horizon Europe. This will be the biggest ever multidisciplinary research programme undertaken in Europe, with a budget of €95.5 billion over 7 years. Within Horizon Europe, health is identified as a global challenge, with a dedicated budget of €7.7 billion available for targeted research to promote the health and well-being of Europeans. The programme is designed to advance our knowledge and build our health research capacity. Ultimately, the goal is to devise innovative solutions capable of transforming our healthcare systems, which deliver real improvements to people's health and their well-being. In our post-Brexit world, European and international collaboration is a strategic priority for Ireland, which will be advanced through Horizon Europe. There will be dedicated research and innovation funding calls, Mission in Cancer and EU co-funded partnerships. To make this happen, the HRB and EI will work closely together to provide practical assistance to Irish researchers, creating awareness, supporting you to successfully compete for and secure this funding. As a start, this event will provide you with an in-depth look at the opportunities for Horizon Europe health funding. I would encourage each and every one of you to consider the opportunities that this funding programme presents to advance Irish health research and create teams across Europe to tackle health challenges that no one nation can do on its own. As a nation, Ireland has a proven track record that we can be really proud of. Through Horizon 2020, Irish researchers secured €85 million working with international partners across a wide range of topics. These included mental health and well-being in the workplace, quality of life for people with palliative care needs, the tackling and prevention of infectious diseases, very topical right now obviously, artificial intelligence solutions for cancer survivorship and quality of life, stem cell research to prevent the development of osteoarthritis, e-health solutions to enable patients to proactively self-manage their chronic disease, something we'll be doing more and more of in the coming months and years. I look forward to hearing more about how we're building on Ireland's success to secure EU funding for health through Horizon Europe. Thank you very much.
Thank you for your support, Minister Donnelly. The Department of Health and the Health Service are key partners in Horizon Europe Health Research Agenda, and we look forward to working with you and your team over the next 7 years. We will move on now to hear from the European Commission. I would like to introduce Dr. Irene Norstedt as the Director responsible for the People Directorate within the DG for Research and Innovation in Brussels. This is the directorate that oversees the the Horizon Europe Health Cluster. Dr. Norstedt has a huge experience of health research working with the European Commission since 1996. She was previously head of unit for the Personalised Medicine Unit, and she was one of the key drivers for setting up the Innovative Medicines Initiative, IMI, a public-private partnership between the Commission member states and the pharmaceutical industry. Prior to joining the European Commission, she worked for the Swedish life science company Biocor AB and at the Swedish Embassy in London. Welcome, Dr. Irene Norstedt.
So hello, I'm Irene Norstedt and I am Director for the People Directorate in DG Research and Innovation. It's my pleasure to tell you a little bit more about the new program Horizon Europe and inform you about the rationale, its structure and also the opportunities that this new program will bring. So why do we need to support research at European level? Well, EU-level action is often the best option to address certain areas for research because of the scale and multidisciplinarity. Or because some national funding bodies do not provide certain type of funding, for example, the ERC grants, Marie Sklodowska-Curie actions and the EIC SME funds. The European approach can also enable greater impact, for example, in rare diseases, where at national level both research capacity and patient numbers can be really limiting factors. Another example is COVID-19, where we could mobilize at scale and speed. Indeed, the COVID crisis has confirmed that preparedness is an area we really need pan-European and global approaches. We could rapidly mobilize this time because of our experience from a decade of EU actions in research in areas such as SARS, Ebola, Zika and influenza. The framework program also fosters investments in and access to research infrastructures. It also gives more opportunities for researchers, especially for pan-European and global opportunities for collaboration and for the researchers' careers. So what is the aim of Horizon Europe? Like previous framework programs, this new 7-year program is intended to strengthen the European Union's scientific and technological basis in order to help tackle the major global challenges of our time, and now with an emphasis on contributing to achieve the United Nations Sustainable Development Goals. How will Horizon Europe look like and how will it differ from the previous framework programs? Well, Horizon Europe is an evolution rather than a revolution. It has been developed through a process of co-creation with stakeholders, both internal and external to the Commission, and it is intended to be much more impact-driven. It translates into the destinations and missions concepts. If we start with Pillar 2, we see that the societal challenges of Horizon 2020 have become the global challenges of Horizon Europe. It's structured in 6 clusters, one specifically dedicated to health. Pillar 1 will focus on excellent science and with Pillar 2, the innovative Europe pillar, which will be implemented largely through the European Innovation Council. At this point, it's very important to highlight that health research can be funded in all the 3 pillars and in all the different instruments, while the health cluster under Pillar 2 is specifically dedicated to collaborative research. Under Horizon Europe, basic research on health will continue to get extensive support through Pillar 1. Already in Horizon 2020, the ERC and the Marie Sklodowska-Curie actions are actually providing a lot more funding for health research than the current health program. Also under the excellent science pillar, Horizon Europe will contribute to support research infrastructures, which has proven to be vital investments in health research and in particular now during the crisis, such as, for example, the European Virus Archive and the Transvac infrastructures. We also expect SMEs to benefit increasingly through the European Innovation Council, as it did already in its pilot phase in Horizon 2020. Not least through the last call, which was topped up to specifically address COVID-19. In fact, about 500 million euros of the European Innovation Council funding is expected to be spent on health-related research and innovation done by companies. And this is really a fantastic figure. And we will also continue to develop synergies with other programs, including the new EU for Health and Digital Europe program, through the structural funds, to name a few. The Commission also plans to continue with financial instruments like the Innofin Infectious Disease Financial Facility, which was reinforced with 400 million euros this year to tackle the COVID pandemic, to help companies like CureVac and BioNTech to help develop their novel vaccines. So this new program will continue to support the whole research and innovation cycle in an integrated manner, from fundamental research to understand the mechanism of a disease into developing a new therapy, to just mention one example. But I would now like to come back to Pillar 2 and our strategy for the health cluster. The foremost aims of this health cluster is to contribute to the promotion of social cohesion and inclusiveness and the health and well-being of people. What does this mean in practice? Well, it means to help develop an economy that works for people by supporting research and the coordination of research efforts in order to make innovative, high-quality health technologies and healthcare both available and affordable for citizens, and to make healthcare systems more accessible and sustainable, including through the digital transformation of health and care. So to achieve these ambitious goals, we need to address some major challenges: a complex evolving demography, aging, multimorbidities, immigration and other aspects, achieving greater resilience and equity in our healthcare systems, and the need to be better prepared for the accelerating pace of change and possible shocks to our societies, as the current pandemic has showed so comprehensively. Research and innovation actions under this cluster will be key to address the health-related challenges by advancing knowledge and capabilities, and by improving our understanding of health and diseases, and by developing innovative methodological and technological solutions to better manage health and disease, and by designing sustainable approaches for the digital transformation and the delivery of integrated, person-centered and equitable health and care services. On that basis, the health cluster is structured around 6 destinations. To reach destination 1, staying healthy in a rapidly changing society, research and innovation should provide new evidence, methodologies and tools to understand the transition from health to disease, preventing diseases and promoting health. Expected impacts include the promotion of healthier lifestyles, behaviors and environments to enable citizens to stay healthy throughout their lifetime. Innovative evidence-based services, policies and guidelines for health promotion and disease prevention should also be attacked. Accessible, equitable and effective co-designed digital solutions for promising and preventing diseases. And finally, strong collaborations across sectors and with other Horizon Europe clusters to transform the healthcare system from reacting to illness to proactively promoting health and preventing disease. Destination 2 is about living and working in health-promoting environment. The environment we live in and work in has a direct or indirect beneficial or adverse impact on human health and well-being. It is a major determinant of health and well-being. Among the expected impacts are the knowledge base necessary to identify and assess the risk and benefits for health of living and working environments in order to enable the design of health promoting and disease preventive policy actions and dissemination of best practices. Solid scientific evidence and uptake of research results into relevant environmental, occupational, social, economic, fiscal or health policies at EU national and regional level. And finally, as well as new and improved health interventions, technologies, tools and services for health and care. Destination 3 focuses on tackling disease and reducing disease burden. The expected impacts are for health burden of diseases in the EU and worldwide to be reduced through effective disease management, including through the development and integration of innovative diagnostic and therapeutic approaches, personalized medicine approaches, digital and other people-centered solutions for health and care. In particular, patients should be diagnosed early and accurately and receive effective, cost-efficient and affordable treatment, including for rare diseases, due to effective translation of research results into new diagnostic tools and therapies. Premature mortality from non-communicable diseases should be reduced by 1/3 by 2030. Mental health and well-being should be promoted, and the voluntary targets of the WHO, which has an immediate impact on the related disease burden. This is called the DALIs. Healthcare systems should be better prepared to respond to health emergencies. People should benefit from reduced health threat of epidemics and resistant pathogens. And finally, patients and citizens should be knowledgeable of disease threats. They should be involved, they should be empowered to be able to make and shape decisions for their health and to better adhere to knowledge-based disease management strategies and policies. And as you know, with COVID-19, this is something really important. Destination 4 is ensuring access to innovative, sustainable and high-quality healthcare. Research supported under this destination should contribute to the following impacts. Health and social care services and systems that have improved governance and are more effective, efficient, accessible, resilient, trusted and sustainable, with health promotion and disease prevention at their heart. Healthcare providers that are trained and equipped with the skills and competences suited for the future needs of the healthcare systems. People that are enabled to play a key role in managing their own health and care, and informal carers that are fully supported and specific needs for more vulnerable groups that are recognized and addressed. People should benefit from improved access to healthcare services, including safe, effective and affordable essential medicines and vaccines. Health policy and systems can adopt a holistic approach for the evolution of health outcomes and value of public health interventions and the organization of health and care in decision making. Destination 5 is about unlocking the full potential of new tools, technologies and digital solutions for a healthy society. Research under this destination should contribute to Europe's scientific and technological expertise and know-how, its capabilities for innovation in new tools, technologies and digital solutions, and its ability to take up, scale up and integrate innovation into health and care. It should enable researchers, innovators and healthcare providers to use health data and artificial intelligence supported decision making in a secure, ethical, acceptable and trustworthy manner. And citizens should benefit from targeted and faster research results in safer, more efficient, cost-effective and affordable tools, technologies and digital solutions for effective personalized disease prevention, diagnosis, treatment and monitoring for better patient outcome and well-being, in particular through increasingly shared health resources. Destination 6 is maintaining an innovative, sustainable and globally competitive health industry. The health industry is a key driver for growth and has the capacity to provide health technologies to benefit of patients and providers of health and care services in Europe and worldwide. At the same time, the path of innovation in health is long and complex, and the development of novel health technologies often involves high risks. Research funded under this destination should contribute to a healthy industry that is more competitive, sustainable and growing, providing high-value jobs and contributing to economic growth, in particular for small and medium-sized companies, by tapping into markets and providing European leadership in breakthrough health technologies and innovations. Citizens, healthcare providers and health systems should benefit from swift uptake of innovative health technologies and services, offering significant improvements in health outcomes. Health industry should work more efficiently along the value chain, from the identification of needs to the scale up and take up of solutions at national, regional and local level, including through early engagement with all stakeholders to ensure suitability and acceptance of the new solutions. So in Horizon Europe, we will of course also continue with partnerships. And here we have both partnerships such as public-public partnerships, where we partner up with research funders at national or even regional level. And we also have public-private partnerships, such as the current Innovative Medicines Initiative that we will propose a continuation, but with a wider set of industry associations, broader set of technologies and slightly different type of scope. We will also continue to engage at the global level through a proposal also for a follow-up of the current European and developing countries clinical trials partnership, which is a specific partnership with partners in sub-Saharan Africa. Another feature of Horizon Europe, and this is a new feature compared to Horizon 2020, and this is the missions. There are 5 mission areas being developed. One of those is specifically dedicated in the health area, and this is the mission on cancer. This mission will of course actively contribute to the Europe's Beating Cancer Action Plan. And here we have had a cancer mission board who has worked very hard over the last year to develop a report that was handed over to the Commission in connection with the Research and Innovation Days in September. This report identified 5 areas of action, and these are understanding, prevention, diagnosis and treatment, quality of life and equitable access. It makes 13 specific recommendations, and we are currently exploring the possibilities for how they can be implemented. So, but how do we continue now, and how have we also shaped Horizon Europe? We have actually worked in a different way this time compared to any previous program. Because we have used a lot more consultation processes, when we have done a lot more what we call co-creation and co-design, both inside the Commission and also with external stakeholders. And I would specifically like to mention the open stakeholder consultations, which has been done online, and also the European Research and Innovation Days, where we had our first one in 2019 and the second one in September now in 2020. And this has been really important events, which has helped us to also shape this future program. So where are we now and what are the next steps? Well, we are working very hard now to into the implementation of this new program, and we aim to launch the first calls for proposals mid-spring 2021, and with deadlines we think after the summer, sometime in the early autumn. It is a bit tentative for this time, as there are several factors that is a little bit out of our control. But I would like to also mention a couple of very specific issues which are more of horizontal nature, which is really important to think about. We have now gone through more the specificities for health research, but I think there are a couple of other issues that are really important for this program that will need to be implemented not only in health but in all the different areas. One of them is gender. The integration of the gender dimension into the research and innovation content is really important and will be further strengthened. And a novelty in Horizon Europe will be the gender equality plans that will become an eligibility criterion for public bodies, research organizations and higher education institutions. This is really important to be aware about, so please make sure that you do have such plans in your institution. Ethics and integrity remain absolute priorities, absolutely. In Horizon 2020, we have further worked on open science and the open science practices. This will also continue to be a very strong priority, needs to be taken into account. Also, the social sciences and humanities needs to be taken into account, also in all the areas. And last but not least, international cooperation. Of course, health is an area which lends itself very much to cooperation at the international level. This is, of course, also a very strong priority for us in the health field. So as we move forward now to the first calls, what should you expect? Well, actually the work programs will look slightly different than what I have done in the past. They will focus a lot more on the impact, and actually the work programs and the topics will request pathways to impact, which means that there should be a focus on which impacts the projects should achieve. And the topics will give a challenge, and it's then up to the applicants to present a convincing trajectory to achieve the impacts that are requested in this specific topic. This is quite a new approach that will demand some thinking from you as applicants how to go about. The application process as such will not change. There will be the same 3 evaluation criteria that has been used before, but it will be somewhat simplified, and in particular the implementation criterion. So what can you do now? Well, stay informed, keep informed. You can follow us on Twitter. You can also register on the European Commission's portal for funding and tenders opportunities, and there you will also find regular updates. I also encourage you to keep in touch with your contact points in your country. They are there to guide you through the opportunities of this future program, and their contact details are also available on the portal that we have. Get involved. We are constantly looking for help to evaluate projects. This is also a good way to learn more about how the EU funding is working. So we very much encourage you to register on again on our portal to become an independent evaluator for one of all the different programs that we have under Horizon Europe. So in conclusion, Horizon Europe builds on the past experience, on our investments, and on the networks and partnerships that we have done and gained experiences from through Horizon 2020 and previous programs. And it will offer plenty of opportunities for collaboration at European and at global level. And we are very much hoping that this new program will have an even higher impact than our previous programs. And I very much encourage all of you to participate as an applicant, as an evaluator, and also, of course, in any of the future events where you can learn more about the specificities of this program. So thank you very much for listening, and we hope to see you soon.
Thank you, Dr. Norstead, for this very comprehensive insight into the health cluster under Horizon Europe. Your presentation will provide an excellent reference to draw on over the coming period, and we look forward to working with you closely over the coming years. Moving on with the agenda to the next session now, we wanted to share some details with you on current Irish engagement in EU health research, and to bring your perspective from some of the Irish researchers themselves who are involved. I will now call on my colleague, Kay Duggan-Walls, to provide you with some details of how successful we've been in the predecessor programme, EU Horizon 2020, and to lead us through this session. Kay is a member of the Irish Health Research Team and most likely familiar to many of you here today. As a national contact point, Kay has worked with Irish researchers over the past years through FP6, FP7 and Horizon 2020. And we're delighted that Kay will bring her experience to bear in Horizon Europe too. So handing over to you, Kay.
Good morning, everybody. I just want to highlight how successful Irish researchers have been in Horizon 2020. So if you look at the slide here in the middle, we have drawn down 84.7 million in the 7 years from 2014 to 2020. And that we have exceeded our target of 80 million, which was set at the beginning of Horizon 2020. And on the left-hand side there, you can see that we have drawn down 2.1% of the total EU budget in health. And having been successful in 111 projects with 14 coordinators or researchers who lead these projects. And 5 of these coordinators have been from NUI Galway, which is very good. And 4 of them have been in the regenerative medicine area. The areas that we've been most successful in have been in mental health, artificial intelligence, cancer, palliative care, big data, regenerative medicine, and ICT for health. And if you look again in the middle of the slide, ICT for health has drawn down 15.4 million with 18% of the total budget. Then in the first 4 years of the Horizon 2020 health programme, there was an SME instrument. Now these topics have gone to the EIC, which Garrett will talk about later on. But 7 SMEs in phase 2 were successful, drawing down 20 million of that total 84.7 million. So that was very successful for Irish researchers. And again, you can see that multinational companies were involved as well. IBM, Icon and Boston Scientific drawing down 5.6 million euros in the 7 years. There has been a very strong involvement as well of the public sector, including the HRB, the HSE, the Department of Health, the Department of Agriculture and Food, HPRA, the Health Product Regulatory, the HPSC, SFI, and many hospitals as well. And if you look on this slide at the very top there, you can see that the higher education institutions have drawn down most money and industry has a little less. Up to 2019, it was even between the higher education institutions and industry, but higher education institutions now have tipped them slightly. In this slide here, we haven't included the COVID-19 calls. There were 2 rapid response calls early in 2020 in January and April, and Irish researchers were very successful in 11 proposals, drawing down 4 million. And in 2019, per capita, Ireland was the 3rd highest recipient of health funding and ranked 11th overall, which is very good. Now we're going to get the views of a number of these very successful health researchers. So first, Professor Stephen Pennington, founder and CEO of Artoris, a spin-out company from University College Dublin. And Professor Pennington is also Professor of Proteomics in UCD, and his company is a partner in 2 health projects. Then we have Professor Paul Ross from University College Cork, who is Director of APC Microbiome Ireland, an SFI centre. And Professor Ross is a partner in a very important project on coordinating and supporting research on the human microbiome in Europe, building consensus on priorities for the future of microbiome science and its translation. Then we have Professor Malcolm McLaughlin, Maynooth University, who is Professor of Psychology and Social Inclusion and is Director of the Assisting Living and Learning Institute. And he is coordinating one of the largest projects funded, having been awarded 21 million for a multidisciplinary project on smart and healthy aging mediated by technology. Then we have Dr. John Densmore from Trinity College Dublin, who is Usher Assistant Professor of Digital Health and Deputy Director of the Trinity Centre for Practice in Healthcare Innovation. And Dr. Densmore has been very, very successful. He's coordinating not just one of these projects, but 2. Professor Ella Arnsman is from the School of Public Health in University College Cork, and she has recently been appointed Professor of Public Mental Health. And she is also Chief Scientist at the National Suicide Research Foundation. And Professor Arnsman is coordinating a project on mental health promotion and intervention in the workplace. And finally, Professor John Kelleher, Technical University Dublin, is academic lead in the Information Communications and Entertainment Institute at TU Dublin. And he's also the SFI lead for the ADAPT Centre. He's also the TU Dublin lead for the ADAPT Centre. And he's a partner in a project on machine learning and predictive modelling for stroke. So now let's listen to their contribution. Thank you.
Hello, my name is Steve Pennington. I'm the founder and Chief Scientific Officer of the UCD spin-out company, Aturos. I'd just like to take this opportunity to thank Kay Duggan-Walls for giving me the opportunity to relate to you some of the experience Aturos has had in engaging with EU funding initiatives as we approach the launch of Horizon Europe Health this year. Aturos is a research and development intensive startup. It's focused on the development of blood protein biomarker tests to support patient and clinician decisions in chronic diseases, with the intention of providing better outcomes for patients. The test that the company are developing is based on a platform for protein biomarker measurements that's mass spectrometry based. And you can see here a picture of the Aturos laboratory in the Conway Institute. The company has a pipeline of tests and associated intellectual property. So far, it's received and successfully participated in a number of different EU funded programs. So we successfully completed an SME, small to medium enterprise instrument phase 1 proposal and received funding for preparation for business planning. The company is a partner in a screened consortium, which is screening for endocrine disruptors, and that consortium is part of a group of 7 other consortia, which are combined into an EU cluster. The company is also a partner in an Innovative Medicines Initiative program, SOFIA, which is based on the stratification of obesity phenotypes to optimize future therapy. And most excitingly, the company is a co-leading partner in a new IMI project that will be announced and kicks off in next month. So in looking at the benefits that's brought to the company, obviously it's meant that we've had a greater awareness of EU funding opportunities, and that potentially will lead to future applications. Aturos is clearly now on the EU radar. And I suppose one of the key benefits is the networks and associated linkages that being a partner or participant in these programs affords us. And we're keen to make sure that that's aligned to the company's growth. So our observations are that it's relatively easy to play a partner role in an EU consortium, certainly compared to leading a consortium. But obviously, as a partner rather than a lead, one has less project control. The overheads associated with these EU grants are fixed and not particularly generous. And it's really important to note that you can only claim and receive funds against what has actually been spent. So I guess our observation would be not to do it for the money. And even if you do, it's important to ensure that there's really good alignment with the company's goals and commercial aims. And that's, I think, especially relevant for partnering in these large collaborative projects. The SME specific calls are very different. They're very competitive, but they potentially have really good gains in terms of the funding and that being equity free. So in that case, our observation would be to do it for the money. And so with those brief thoughts and observations, I'd just like to thank you. Thank again, Kay Duggan-Walls, for giving us the opportunity. And if you wanted to follow up with any questions or comments, then please don't hesitate to email myself or Kieran Duffy at Aturos. And it's just worth pointing out that Kieran has a lot of experience as a former national contact point for Ireland for EU health initiatives. So thank you.
Hello everyone, my name is Paul Ross and I'm Director of APC Microbiome Ireland, which is an SFI funded research centre located in Southern Ireland in Cork. We were formed about 18 years ago at University College Cork, and we're about 300 people, which makes us one of the oldest and the largest microbiome centres in the world. what we study is the bacteria that are in the human body, mainly in the intestine. We have about 100 trillion bacteria in our intestine that make up our microbiome. The number of genes in that consortium outnumber human cells in the body 150 to 1. It's been estimated there's about 10,000 different species that have been now identified in the human microbiome. And so it's almost like a bioreactor within each one of us. And I suppose what makes it so exciting is it's malleable. We can manipulate it. Unlike the human microbiome, it's medically and genetically accessible. We became interested in being part of an EU consortium when we saw H2020 call about a year ago now. And this was to coordinate and support research on human microbiome in Europe and beyond. We got interested in coordinating this because this is, if you like, our business, you know, working on human microbiome. And what we did was we started to contact partners, but then we became aware that Professor Joe Eldora, a friend of ours and you know, a research colleague at INRA in France, was also coordinating the call. And so what we did is we merged both, was coordinating a submission. And so what we did was we basically merged the two initiatives and formed the International Human Microbiome Coordination and Support Action Group. And basically, we submitted the project to the EU, which has now been funded. We're delighted with it. Because what it's going to do is going to, for the first time from a European perspective, map the current scientific state of play in the microbiome. It's going to identify a path for research to create real impacts. And it's going to build a consensus on EU microbiome for science and translation. And indeed, one of the main outputs of the project is going to be a white paper that we're going to write up, which basically gives a state of play and a way forward in this whole area. One thing I really like about this project is I feel it's going to be a genesis and build a foundation for future calls in the human microbiome across Europe. One of the main things that we want to achieve in this is basically to improve people's health by manipulating the microbiome. To do that, you need to know what healthy is. And that's why I'm so excited by our role in the project, is basically to look at all the research that's out there and try to understand what makes up a healthy microbiome. As I said, we all have a huge amount of bacteria within us, 150 times the genetic component of the human microbiome. But what makes it unusual is we're very, very different to each other. And there is a huge inter-individual variation in the microbiome. It's actually almost like your fingerprint. And that's what makes it difficult then. If we're also different to each other, why are we different? Well, there are a whole range of different reasons. What we eat, our diet, the medication that we're on, medicine, our lifestyle with regard to health and exercise, they all have a huge influence on our microbiome. And so by looking in detail into the composition and metabolic functioning of the microbiome, we hope that we can find what makes a healthy microbiome, and then be able to build on that and come up with new medicines or whatever to improve the composition of the microbiome to improve human health. And that's the basis of the project. Thank you.
Hello, everyone. My name is Mac McLaughlin. I'm the coordinator and speaking on behalf of the coordination team of SHAPES, which is myself, Michael Cook, and Niamh Redmond. SHAPES stands for Smart and Healthy Aging Through People Engaging in Supportive Systems. And it's a European project led by the All Institute, Assisting Living and Learning Institute at Maynooth University. The project is over 48 months. It has around 210 staff. It's across 36 different organizations, and we work across 14 European countries. So that will be engaging over 2,000 older people in 15 different pilot sites. From a management perspective, we have 10 different work packages, and it's funded to 21 million euro. So how did we build the network? Well, we used prior existing contacts that we had ourselves, and we also specifically hired a couple of very good consultants based in mainland Europe. And between ourselves, we had basically identified very good people who we felt we could trust, and we also got them to identify good people who they felt they could trust. In the innovation action, which is what SHAPES is, we are going to build, pilot and deploy a large-scale EU standardized open platform. And the aim of this platform is to facilitate long-term healthy and active aging and the maintenance of a high-quality standard of life for people in the community. So we look at digital technologies, the ecosystem to support that, the marketplace around it, and also policy and systems recommendations. The question, how interdisciplinary or multidisciplinary are we? Well, we didn't even start, if you like, from that perspective. We started with what was the ask, what's the task that we need to achieve, what are the competencies we need to deliver on that, and then backing into what sort of people are going to be most appropriate. And then we find there's certainly most of the, I'd say probably all the health disciplines, most of the social science, and most of the computer science and engineering disciplines. But we didn't start from a disciplinary perspective. We started, of course, by answering the call. So in terms of the SHAPES partners, we have here the, in green, where they're located, and then also the pilot sites in the sort of goldy color. So basically a good distribution around Europe. You can see on the pie chart quite a lot of small and medium enterprise, 40%, about a third universities, and then we have NGOs, public sector bodies, research training organizations, and large-scale industry. This was the, I guess, the overall structure for it, the way in which we help people to understand the connectivity between the different strands, and at each meeting we revisit this. What lessons have been learned? Have a clear concept and a clear graphic so that everyone in the consortium can come together and basically say this is what we're about. Large consortia need a very high level of communications, not just from the communicators ourselves, from the coordinators ourselves, but also from work package leads and indeed task leads. As well as that, important to implement streamlined project management and communication software where possible. We also think it's really important to monitor resource allocation on a quarterly basis. So as well as your general assemblies and your program management boards, etc., to really track what people are doing and what they're claiming for, because that's a good sign of whether they're keeping up, not just with deliverables, but with other aspects of the work that might not be deliverables per se. Any change to the project will have knock-on effects, because obviously there's a lot of integration in these sorts of projects, so to think through carefully any changes, and to, which I'm not at the moment, but to talk slowly, be kind and respectful to others, and to be decisive. So kind and respectful because, you know, people obviously coming from very different countries, different cultures, different disciplines, different ways of thinking, and really important to be respectful, but to be very decisive. And, you know, I think we find that if people can trust the goodness of your intentions, then they're okay to disagree with you every now and again, if they're sure that you have the overall good of the consortium in mind. And then finally, as a coordinator, even though it can be tempting in your own sort of small area, don't be an expert. Try and maintain the role of being the coordinator. In other words, looking at the process and the management of the project, and trying to pull out other experts to make points around expertise where that's appropriate. I look forward to hearing the other presentations. On behalf of SHAPES, thanks very much.
Hi everyone, my name is John Dinsmore. I'm the Usher Assistant Professor in Digital Health and a Deputy Director of the Trinity Centre for Practice and Healthcare Innovation at the School of Nursing and Midwifery at Trinity College Dublin. And in the next 5 minutes, I'm going to give a very brief overview of my experience in leading an EU project. I've been very fortunate under Horizon 2020 to secure 3 awards, 2 as coordinator, that being PROACT and CERO. And PROACT was the starting point for my involvement in leading an EU project. We were secured in 2015, we started 2016, and we received 4.87 million to develop a digital platform to enable older adults to self-manage at home with multimorbidity. It was a hugely successful project, and what you can see here in this image is that the outputs from that project have enabled us to secure further awards at both national and EU level. That's included a Marie Curie ITN. There are 5 academic partners, Trinity's 1, and CERO, which will see the PROACT platform move from proof of concept testing to large-scale trials. I've included the links here, and in the interest of time, you know, I'd advise if you could explore the links, you can see what the projects are about and how they interlink. So to get to the focus of this presentation, you know, what's involved in leading a project. Firstly, time. The commitment is significant, so make sure you have the capacity. Your role as coordinator is to, you know, see all the moving parts of the grant and bring it together. And there are a lot of moving parts in these big grants, so that takes a lot of time and commitment to do that. The second point is people management, and I think this is the most important factor. In PROACT, we had 54 people across 12 organizations in 6 member states. So your ability to manage at a local level, but also at an EU level, keep everyone committed, understand the politics and dynamics of your partner organizations, and help them in the implementation of the action or the project, as well as get through challenging periods, is hugely important. That comes to my third point, your problem solving ability. If you're funded, your work program's solid. So it's probably factors outside of that that will impact. In our case, in PROACT's case, it was Brexit. One partner shut up activity in the UK, and we had to transition work to the Netherlands. So the team changed, and that caused challenges at that period in the project, and we had to work through that. So linking in with your project officer and maybe national contact points to support you in these processes is hugely important. And it worked in the end, and again, PROACT was a success. And then my final point, communication momentum. These projects happen over a number of years, setting your standards for, you know, what you expect from the consortium, when meetings will happen, you know, when deliverables will be expected, the level and standard that you expect of those deliverables is really important. So set that standard early, set the communication processes early. In my consortia, I like to have weekly technical and research meetings. It seems like a lot, but the partners actually work with it. Not everyone has to attend. As long as somebody from the organization attends and, you know, feedback and you know, give updates, it seems to work really well, keep everyone on board. So advice if you're considering leading a project in Horizon Europe, find a mentor if it's your first time. It will save a lot of pain in terms of understanding the processes. Know the call inside out, including the frequently asked questions and any related documents that are on the website. Choose your partners wisely. Big red flag for me is if they're not contributing to the proposal and you drag them through, chances are you might struggle with them if you're awarded. Keep calm and focused, particularly in terms of applications. You'll get a lot of thoughts, a lot of input. As coordinator, your role is to structure the vision and make sure that you're happy with it in terms of moving forward, because that's what you will be awarded to do. So you have to be confident in that vision and your ability to deliver it. Use the support of your finance, research and legal offices in your institutions, your national contact point, and once you're awarded the grant, or if you're awarded the grant, establish a good relationship with your project officer. Lead by example on the grant as well as in the project. So, you know, as a coordinator, I find you're writing most of the application. It could be 80 to 90% of the application. You're getting input, but you structure it, you write it. It takes, I think, one person to keep the narrative consistent. And in terms of the grant, if you're awarded, I always make sure our organization leads the first deliverables. So we'll set the standard and everyone else will then see that. Be organized from the beginning, have good project management in place, and as I said, that helps with communication and keeping that momentum, and set that high standard early and never drop from it. That would be my advice. And then finally, what are the benefits of getting involved in the EU project? Well, definitely advancing your research career at an international level. It's a fantastic opportunity. It'll help develop your research expertise, you know, with the consortium and all the expertise and of all the partners that comes on board, but also your research management ability and you know, from legal and finance and all these other perspectives, not to mention your grant writing, because if you secured it, I mean, you know, you've done extremely well, and that will stand forward, or that will help you forward, sorry, in terms of applying for future grants. Advancing your career, I mean, the peer recognition of achieving or securing a large award, the publications and outputs, and we've a lot coming from PROACT and related projects at the minute. You'll expand your network, which will help you then apply for other awards and find other opportunities. And that includes, for example, for us, we're spinning out now some of the IP created in the project, which as an academic is hugely exciting. And then finally, as a coordinator, it's personal development. It will build your confidence. It's a hugely challenging thing to do. You'll deal with pressure and problems at different levels, working with different people across different cultures. So being able to do that and lead on that, you'll learn a lot. And I think just, you know, it's an incredible experience. It's tough, but it's incredible. And I wish you all the best in terms of anyone applying for awards under the new calls. And with that, I'll wrap up. My contact details are here if anyone wishes to get in touch if they have any queries. Thank you very much.
I'm Ella Arendsman. I'm Professor of Public Mental Health with the School of Public Health, University College Cork, and I'm also Chief Scientist with the National Suicide Research Foundation, Ireland. In 2019, my colleagues and I were successful in being awarded a large-scale EU Horizon 2020 grant, an application that was submitted under the health program with a particular focus on the call mental health in the workplace. We refer to this new project as MENTOP, Mental Health Promotion and Intervention in Occupational Settings. And this is a very large-scale project, including 13 European countries, but also Australia. There are a number of unique elements of MENTOP, and one is that we focus particularly on sectors where we have seen high levels of mental health issues and also suicidal behavior, such as construction, the health sector, but also the ICT sector. In addition, we focus very specifically on small and medium enterprises, SMEs, because overall they do have very limited resources and supports when it comes to health and safety, but also for mental health supports and resources. There are a number of unique elements of MENTOP, and one is that we specifically distinguish between intervening in relation to mild to moderate mental health issues, mild to moderate depression and anxiety. But on the other hand, we also have developed resources for more severe clinical disorders, severe depression and severe anxiety. Another unique element of MENTOP is that we don't only focus on employees, but we also focus on health and safety officers, supervisors and managers. So we would like to focus on all important levels in an organization. Why did I apply in 2018 when the whole process started? So Over many years, my colleagues and I have been working in the area of mental health and have applied to many different grants at EU level, going back as far as FP6, FP7, but also under the DJ Senko program. And in addition, with my colleagues in the European Alliance Against Depression, EAD, we have been successful in multiple grant applications over many years. And in this, we have also built very close links with colleagues in EAD in different relevant disciplines for these types of mental health applications. In addition, then, for this particular call, we had clear evidence that there were high levels of suicide and other mental health issues, particularly for the sectors in the work sectors in construction, health, and ICT. So we felt that there was an urgency to start applying under this EU call. So this represented an important motivation for us to apply. Now, the specific health call in 2018 and 2019 was a two-stage process. So we first had the preparation of a number of months working towards an expression of interest, which was still very significant. And I would always be in favor of this two-stage process because the advantage is that even though it's an important investment, after a few months, you know whether you can go through or not through the next phase, but also you have an opportunity to receive helpful feedback with which you can then improve the application for the second stage, the final stage. Another important positive experience has been to work with a project management company. This has been very beneficial in terms of assistance, but also speeding up the work in terms of preparing such a large-scale application. So ideally, with a project management company, they will take care of a lot of the administrative aspects, but also planning. So you as a researcher can focus very specifically on the scientific content and also issues that relate to excellence. So what do we hope to achieve with this important project, the MENTOP project? We hope to achieve a greater insight into mental health promotion programs, its implementations, but also its effectiveness in relation to SMEs in these different work sectors. But overall, I also very much hope that the MENTOP project will make a significant contribution to reducing stigma relating to mental health, and then particularly in the workplace. In many countries where we're working with the MENTOP project, there's still high levels of stigma, which do prevent employees and others in a company to seek help in a timely manner. So we very much hope that with MENTOP, we can make a difference.
Hello, everyone. My name is John Kelleher, and today I'm going to talk to you about my experience and some of my advice in relation to European funding. To give you some background on who I am a computer scientist at Technological University Dublin, where I'm the academic leader of the ICE Research Institute. I'm also a co-principal investigator at the ADAPT Research Centre and in the Centre for Research Training in Digitally Enhanced Reality. And finally, and most relevantly for today, I am a work package lead on the Horizon 2020 Precise4Q project. My research is in the area of artificial intelligence. Originally, this focused on dialogue systems and human-robot interaction, but for the last 10 to 15 years, I focused on machine learning and natural language processing. The project I'd like to talk to you about today is the Precise4Q project, which is focused on using machine learning to create clinical decision support systems for the treatment of stroke. The consortium of partners involved in this project are from across Europe, and I became a partner in this consortium through teaching a machine learning course at one of these partners, where I met an academic who was involved in preparing the proposal. And after the course, they invited me to join the group and help in preparing the project. The project involves creating machine learning clinical decision support systems for the different stages of stroke, including prevention, acute treatment, rehabilitation, and reintegration. And at TU Dublin, we're leading the development of models across all these 4 stages. My advice in relation to European funding would begin by recognizing the fact that Precise4Q was the first grant that I secured significant funding through, but it certainly wasn't the first one I applied for. In fact, it wasn't the first one that the consortium applied for. We had actually identified a target call the year before and applied for that. We got close to the bar, but weren't successful. And so we took the feedback from that application and identified a new target the following year. And using that feedback, improved our application and reapplied. And we secured the funding on that second attempt. So the first piece of advice I would talk to you about is, I would say, if you don't succeed, reuse the proposal. Try to identify a similar call, use the feedback to improve the application, and then reapply. The other pieces of advice I'd give you are, first, I'd focus on working with the best possible partners. The stronger your consortium is, the more likely it is to succeed and be funded. And the second aspect I would talk to you about is look to work with people who complement your research, rather than people who do the same research as you. So in our proposal in Precise4Q, we're the main computer science department, and most of the other partners are clinicians. So this makes it very easy for us to identify complementary research with these partners. More generally, being an academic, you need to get used to failure, for applying to things and being rejected. So I'd advise you to be ready to be persistent and be resilient. Also be ambitious, target working with the best people possible, and seek people who are complementary to your research. I'd also advise you to focus on your trajectory rather than the success of others. It can be very disheartening to focus in on everyone else's success. Remember, they have different opportunities to you, so try to focus on how you're progressing in your own career. I'd also say that writing a large-scale proposal takes a lot of time, but it isn't successful purely based on whether or not it's being funded. As a scientist, you can progress your research a lot just by taking the time to write the proposal, because it helps you to develop new ideas. So it's worth investing time in writing proposals, not only for the funding, but also to help yourself develop and also to create new connections with other top-level researchers. I'd also advise you to use the supports available to you. Use the research offices in your institutions and engage with the national contact points as early as you can. They'll help you get into good research consortia and to identify calls. Thank you for your time. I hope you find the advice useful.
Thank you very much to all of our successful researchers for providing us with an insight into your work. You're truly inspirational role models and excellent Irish representatives on the EU stage. Many of these projects are only recently funded, and we look forward to following your progress and your impact at home and abroad, and we wish you all the best. We're now going to take a very short comfort break, reconvening in 5 minutes at 12:35. When we return, Kay and other members of the Irish National Support Network will provide us with a deeper insight into the current opportunities that will be available from this summer. So thank you very much. Just starting the short break now, and to be back at 12:35. Thank you.
Welcome back. Myself and Martha Cahill, who is the contact point in Enterprise Ireland, will now give you further details of the calls in the Health Work Programme. And Garrett Murray, who is the National Director of Horizon Europe, will talk about the opportunities in the European Innovation Council. So Irene outlined the different destinations, and now Martha and I will give further details. I'm going to talk about destinations 1 to 3, and Martha will cover 3 to 6. So the first destination is staying healthy in a rapidly changing society. And in this destination, there are calls for mental health. There's one in 2021 and another in 2022. There's a call for digital empowerment and health literacy. And there's also artificial intelligence calls, and prevention of obesity through the life course. Destination 2 then is about living and working in a health promoting environment. And there are calls here on exposure to electromagnetic fields, indoor air quality and health, and then the health impacts of climate change and the costs and benefits of action and inaction. And there's also a call on methods for assessing health-related costs to environmental stressors. Destination 3 is about tackling diseases and reducing disease burden. There are lots of calls in this area, and these range from palliative care for end of life of cancer patients to building an innovation platform for the repurposing of medicinal products, innovative approaches to enhance poverty-related diseases in sub-Saharan Africa, and then artificial intelligence solutions for treatment and care, and personalized medicine and infectious disease, understanding the individual host response to viruses. And then there's still further calls in this area. There's immunotherapies for diseases of unmet medical need. There's development of next generation vaccines. And there's also effective therapies for rare diseases. And there's also a call for non-communicable disease risk reduction in adults and youth. I will hand over to Martha now, who's going to talk about destinations 4 to 6.
Good afternoon, everybody. I'm on the National Contact Point for Health. Thanks to Irene Nordstad for giving us a good introduction to all the destinations. And I'm going to give you the highlight of the topics and opportunities in Destination 4 to 6. Destination 4 is about ensuring access to innovative and sustainable high-quality healthcare. In essence, this is all about the modernization of the healthcare system. Just to highlight how the slides are laid out, you have each year that the topics are funded here, you have the instruments involved, and whether it's a single or two-stage call. The first topic is about ensuring the quality of care and patient safety, and this is an RIA, which is a joint research project. The second topic is about data-driven decision support tools for better healthcare. This is specifically focused on cancer, so you should be aware of the European Beaten Cancer Plan and the Cancer Mission and the activities in that area. The third topic is about healthcare innovation procurement network. This is an unusual topic. What it does is it brings together all the stakeholders, procurement agencies, healthcare providers and payers. These can be from primary care settings, hospitals, specialist centres, long-term care facilities. The objective of the network is to look at the challenges and unmet needs, common needs that this cohort require. And then this leads on to procurement topics in 2022. So there's two options for procurement here. So you have proposed solutions that support solutions, and then you have support for R&D to develop new technology where it's required. The final topic is about better financial models for the healthcare system. Destination number 5 is about unlocking the full potential of new tools, technologies, and digital solutions for a healthy society. This is a mix of topics in here, everything from devices, new therapies, and there's a big focus on the use of data. The first topic is a smart medical device for surgical implementation in resource-constrained situations. This is the only IA or innovative action in this program. There's a TRL of 7 mentioned here, and basically what that means is the solution involved needs to be market ready and ready to be deployed. The next topic focuses on the next generation advanced therapies to treat highly prevalent, high burden diseases. This topic looks at stem cell, gene editing, RNA approaches for highly prevalent diseases such as health disease and diabetes as an example. The third topic focuses on the reuse of health data, in particular electronic data and patient registries. This is so that we use reused data that may be used in clinical trials and it can be repurposed for other uses. The first topic in 2022 is on optimizing the effectiveness of patients of existing prescription drugs for major diseases. This excludes cancer, and the use of biomarkers is also included in that. I should have also said that the 60 here corresponds to 60 million in dedicated funding to these topics. The next two topics are data related. It looks at new methods for the effective use of real-world data and synthetic data. The last topic is computational models for new patient stratifications. This looks like personalized data, personalized therapeutic strategies, and as an application for AI and machine learning methods. If you're in the area of AI as well, it's very, very topical in the health program, and you should be aware that there's new legislation proposed, and we can link you to appropriate documents and legislation if you require it. Destination number 6 is about maintaining an innovative, sustainable, and globally competitive healthcare industry. The very first topic looks at green pharmaceuticals, looking at more degradable pharmaceutical products and addressing the environmental issues. The next topic focuses on the procurement and management of new antimicrobials. This is a CSA and is likely to lead to new procurement opportunities and activities in the area of One Health AMR. So that's worth keeping an eye on if you're in this space. The next one is on promoting mobile health labels in Europe and technical specification for mobile health apps. And this is about creating standards and labels for mobile health technologies and connected devices. And this is a CSA, so it's about bringing networks together to have those conversations. The first topic in 2022 is about enhancing cybersecurity for connected medical devices. The next topic is multi-party computational and data anonymization. Again, this is looking at how we can share data by making it anonymous for use and transfer. The next topic is new pricing and payment models for cost-effective and affordable healthcare innovations. The next topic is looking at setting up a smart innovation hub. There are specific references in this topic to European health hubs, so they might be worth linking with. And the last topic is about electronic health records and exchange. And this is going to be very important in terms of looking at health data at a European level and data transfer. So if you're interested in any of these topics or want further information, please feel free to contact us. We will have multiple programs by the end of the year. There will be the new cancer mission, the Innovative Health Initiative, co-funds and partnerships. So the best way to keep up to date is by signing up for our newsletter on horizoneurope.ie. Make sure you click on the health link and you're signed up to the health cluster. And we are all available for contactees or contact details, and these contact details are also on our website. And we look forward to hearing with you and to working with you. I now hand you over to Garrett Murray, the National Director for Horizon Europe, who will highlight some of the further opportunities for health in the Horizon Europe programme and the EIC programme in particular.
Hello, everybody. Nice to be here. Hopefully you can all see slides. So one of the things I wanted to just take the opportunity at this event, and first of all, thank you all for coming, was to talk about Innovative Europe, because much of what we've talked about today so far is about the research element. But as we all know, this is a research and innovation program. So I want to stress that diversity. And I think Irene mentioned that really clearly in this morning's session as well. There are opportunities across all the pillars for people interested in health research. And I suppose that's the central message I want to leave you here today. Now, Innovative Europe has evolved into 3 different areas. So we've the EIC, European Innovation Council Pathfinder, we've Transition Actions, and we have the EIC Accelerator. And much of what is in this program and in this pillar is evolutions of other areas from previous programs. So the Pathfinder I'm going to talk about now evolved from future and emerging technologies, the Accelerator from the SME instrument. But the EIC Pathfinder I want to mention specifically. So it used to be FET, it's now come under Pillar 3, but over the years of the last program, we weren't, as Irish researchers, particularly strong in this area. It did improve towards the end, but Science Foundation Ireland and Enterprise Ireland and our wider network are really trying to get people to focus on the opportunities in Pathfinder and to try and engage more with the program. So A, we can support your research ambitions, but B, we can draw down more money on a national basis. And where Pathfinder is interesting is it's a bottom-up program. Okay, so what you're seeing there is you can get funding of up to €3 million. you have to collaborate with 3 or more partners, and the topics are completely up to you. And where you're moving from is kind of proof of concept, moving your project to proof of concept. And it is a particularly interesting program. The budget's been significantly expanded, and it is something we'd really like you to engage with and work with and see what opportunities there may be. Now, as with most bottom-up programs in Horizon Europe, there's also an element of a challenge being put in there too. And the reason I wanted to stress this in particular was for the audience here today. You know, there are challenges here which are very specific to the healthcare sector. So tools to measure and stimulate activity in brain tissue, emerging technologies in cell and gene therapies. And these are specific calls where there will be a deadline of October 27. There's other areas there like living materials and hydrogen, but I'm obviously not focusing on them here today. There are 4 million, up to 4 million in funding. And unlike the rest of Pathfinder, you can be an individual applicant here as well as a consortia. You know, it's a 25-page proposal. It's very structured. What's expected there in terms of the gatekeepers are very clear. But again, we would really like you to look and see what opportunities you may be able to find in this program and to engage with the relevant NCPs. The transition actions are also a new area within the EIC. And in a sense, what they're trying to do here is, on one side, we've got our Pathfinder, and on the other, we've got the Accelerator, which is innovation in companies. And what the transition actions are trying to do is build a bridge between those two elements of the program. So effectively, it's a way for ERC grants, previous FET grants, previous flagships to do work to translate their activities into innovation, which for there in the future can be supported by the Accelerator. So this is something, again, we think considering the success we've had in that TRL 1 to 4 health research area, there will be significant opportunity for people to avail of these transition action programs. And in a sense, again, the reason I'm stressing it here today, you'll see that there's a challenge within this program, and it's going to be medical technologies and devices from lab to patient. So really what you're seeing is even in the bottom-up programs, there's a challenge in the health area, and there's usually a challenge in the green area as well. So the plan here is preliminary prototypes. Again, you're at 3 or 4, you're trying to move that to 5 or 6 with the view to then going on to the Accelerator ideally. So please think of the transition actions as a bridge, and a very interesting bridge to go from basic research to innovation. Lastly, I want to talk about the Accelerator. Now, several of the panelists earlier on mentioned their involvement in this. It's changed quite significantly. We've had a pilot, it's just finished. What the Accelerator now allows you to do is to apply for a grant of up to 2.5 million and up to 15 million euro in equity, okay? We as Irish researchers and innovators have been particularly successful in this area in the past. And that's why we want to place a very significant emphasis on this going forward, because we think it's a really good place for many of our HPSUs and commercialization fund projects to commercialize and develop further and market their products. There are so many companies I can mention in this area: Coraflow, Poverum, Rockfield. It's really, from the health sector, it's really been an impressive performance. Now, it's a bottom-up program. It's focusing on level 5 or 6 in terms of technology readiness levels and bringing it up to TRL 9. But again, like the previous areas I've talked about, there's a strategic health and digital technologies challenge, which is a specific call which will open in June and close in October. So, or would close in October. The June one is bottom-up. So again, we're seeing those challenges, and again, we're seeing them in healthcare, and we're seeing them in the Green Deal. So in terms of the Accelerator, I've talked about the supports. The grant is up to 75% with the 2.5 million euro. There is, and many of you would know a lot about this area already, but one of the things that's interesting is mid-cap companies can now apply for equity, but also the process for the Accelerator has changed from the pilot. So it's a 5-stage process, but or 4-stage process. But what happens at the beginning now is you do a video, you do a pitch deck, and you do a 5-page proposal. And that's a no-go or go. And then you get into the next stage where you're thereby given consultancy support. And then you go into a remote evaluation. So what they're trying to do is make it much easier for people to know, are they in the realm of being accepted and funded or not? So hopefully that will improve success rates. They've also designed an artificial intelligence platform, which again is to support people to check, do they fit this application? Do they fit what's trying to be proposed under the EIC Accelerator? Are they innovative enough? So again, in terms of projects coming out of the university system and HPSUs, this is a really important program. But what's also important to those of you coming from the research community is many of these companies that have been successful in the successor or the predecessor to the EIC Accelerator are primed and ready as partners for you in consortia, because they've already been through the European research process. They've already been awarded a lot of money, and they're very well positioned to engage with you as a community. So please do come to the NCPs, Jill and Sean, who are again on our website, Horizon Europe, in relation to the ESC, or Martha or myself, and we can try and link you in together. I've talked a little bit about the process there. It all ends with an interview. The interviews obviously have been online, which has been fun to replicate and do mocks for. But again, they're focusing on that business plan, that commercialization. So look, all the links are there. The PowerPoint will be circulated, but two things. Innovation is as important in this program, but building a bridge from research to innovation is really what we're all about. And with the EIC, it's going to allow us to do that in a way that we haven't done before. Finally, all those companies that have been so successful in this program to date are perfect partners for you in future consortia in relation to the health cluster and other areas. And then lastly, what I want to leave you with is, please remember the Enterprise Ireland grant system is there to support you researchers in terms of touchwood travel grants, ERC grants and coordinator grants. And we want to hear from you. But not only that, we still have our large scale grant application. So if you're looking to do something particularly ambitious, something that's going to involve a lot of Irish researchers and innovators, something that's really additional to the system, please come and talk to Martha and myself in relation to how we could support you to doing that. We've seen how that vehicle has been used very successfully in Marie Curie and in other areas to achieve research ambitions and coordination of projects which wouldn't have otherwise have happened. So I'll leave it there and pass on to colleagues, and thank you very much for your time this afternoon.
Thank you very much, Kay, Martha and Gareth, for those insights into the strong health support team that we have in Ireland at the moment, and how that we're there, just to remind people that we're there to support you to actually avail of these opportunities, that the health support team straddles the research health system into the innovation, and also as part of the larger national support network, which has expertise across all of the programs and the opportunities within the wider Horizon Europe team. We're now going to move on to the Q&A panel session, and I wish to welcome Dr. Maura Heine from the HRB. Maura is Head of International Cooperation, Evaluation and Targeted Programs, and will moderate this panel. Just a quick reminder to submit your questions using the Q&A function, to keep it short and specify who you want to direct it to, and to flag with you that we will prepare an FAQ document out of this event today, where we will answer all of the questions that have been raised by yourselves. So handing over to yourself, Maura. Thank you.
Thanks a million, Patricia, and welcome to this Q&A session. I see there's been quite a lot of activity already in the Q&A, and those questions have been answered, but as Patricia said, we've captured all of those questions and the answers, and they will form part of the FAQ afterwards. So on the panel, I have with me a number of people that you've already met, and hopefully one that you haven't yet met. I don't know, she had to step out for a meeting, so I hope she'll be able to rejoin us. So we have Kay Duggan-Walls, thank you very much, my colleague from the HRB, who's the national contact point for one of the national contact points for health, along with Martha Cahill, who is the national contact point for health based in Enterprise Ireland. Obviously taking a more enterprise focus, whereas Kay is more, I suppose, focused on the HRB community and environs. And then, of course, we have Garrett Murray, who is the director of the Horizon Europe Centre, Ambition Network, I don't know what you want to call yourself, Gareth, also based in Enterprise Ireland. Hopefully, we will also have Dr. Anna Longroth joining us. She's a senior expert in the People Directorate of DG for Research and Innovation at the European Commission. And she has also served as head of the Healthy Lives Unit, with focus on health promotion and so on and so forth. And she has been in many, many different areas of the European Commission, leading kind of strategy for health and heading up the life sciences units in the ERC and so on. So I really do hope that Anna will be able to join us later. But if you have questions, you can submit them to us and we'll get Anna to answer them. So Garrett, can I start off with you, please, if you don't mind? And I'm just wondering, there's a lot of different programs flying around. I suppose what I and others struggle with is, what are the connections across the different areas within Horizon Europe, for example, between the ERC and the EIC, or even across different kinds of programs like EU for Health and Horizon Europe?
Okay, so I suppose it's a good question. If we take Horizon Europe in particular, like, you've got Pillar 1, you've got Pillar 2, you've got Pillar 3. And I think one of the lessons we learned in Horizon 2020 is we probably didn't achieve that level of cross-cuttingness that we all wanted to achieve at the beginning of the programme, and as was set out as the ambition.
Yeah.
I think the EIC that I've just talked about it as an example of where they've brought Pathfinder, which is formerly FET, into the innovation section and developed those transition actions with a specific role to try and bring that research through the technology readiness level, and to try and do that in a way where we're linking up the dots. I think there's other areas which are horizontal issues which are also really important. And, you know, one of the things I was speaking to the Humanities Alliance yesterday and on a call with Brussels as well, on how we're going to integrate SSH far better into the clusters. Yeah. And that is something which is particularly important for health, but for other areas as well. And again, we're seeing with that ERC piece trying to bring it to Pathfinder. But I think also if you look at the clusters, you know, health in itself, it probably is easier to talk about because it's quite ring-fenced. But when you go through the program, as Martha and Kay have, it's not that ring-fenced because we've seen ICT runs all the way through the program. And when we look at other clusters, particularly cluster 4, you know, which is ICT, industry and space, we're bringing together colleagues as NCPs from a wide range of areas and to look at the one type of calls and the one type of areas. And I suppose another way to look at that, we were hoping we'd have results today, but they're not out yet, is the Green Deal. We could all find ourselves in the Green Deal, no matter what discipline we were from or what sector we were from. There was something there for everybody. So I think for me, the integratedness and cross-cutting nature of the program is far greater for Horizon Europe. But I think as NCPs, we're going to have to work a little bit harder because innovators and researchers might not find themselves in the program when they look at it in the way they could, in a kind of a mirror fashion they could with Horizon 2020. So, you know, what I'd say to researchers is it mightn't look as though there's something there for you, but I'd be very surprised if there wasn't. And if it isn't for a particular call, it'll be bottom up. So, you know, please come and talk to us. And one of the things we'll be doing as NCPs is working really closely together to make sure that all those areas are covered and that we're passing people into the right areas and making sure they're not losing opportunities.
All right, and that actually, in fact, directly answers the question that somebody had asked in the Q&A about how do I know where to go, what to look at, which program. So it's talk to the NCPs, talk to the national office. They'll give you the advice. And
we will come back to you. And what we'll do is, you know, just because it's not my area, I'll pass you on to somebody else. And we're all talking about the calls. We engage together quite a lot. We're going to be doing a lot of that. And we're only going to be successful as a country in this program and replicate what we've done to date if we embrace this cross-cutting nature of the program.
Yeah.
And I suppose there's probably one or two things I'd add there. We also need to embrace the widening nature of the program, which is key to the European Commission's strategy for Horizon Europe. So when we're developing consortia, we need to be looking at geographic diversity. And also within the questions earlier on, there were one or two cues around gender. And one of the things I didn't mention when talking about the EIC is there's a major focus on female entrepreneurship and participation. And a minimum of 25% of people called to final stage are female leaders. And while there isn't that same quota applied to other parts of the program, there's a massive focus on gender diversity. And for us as institutions to have our gender equality plans ready for any applications after the end of the year. Right. So, you know, we're going to see that focus, and it's something we need to embrace rather than see as a challenge.
Yeah, absolutely, absolutely.
Maura, could I just add something there?
Sorry, go on, Kay.
The social sciences and humanities in the health program, there are lots of opportunities, but it's important that that applicants look very closely, because it is hard to identify them, and perhaps the people who lead on the calls may not see the value of including people from the humanities and social sciences, but you know, there are indicators in the work programme, but come to talk to us as well about that, because it's not clear at first view how you could participate.
Yeah, I think the message is very strongly coming across there. Talk to your NCPs, for God's sake. Anna, we only have you for 15 minutes, and thank you very much for coming back to us. Can I ask you a slightly technical question? And I think it's probably one that it will maybe give people a little bit of pause when they're reading, you know, what they have to fill out. Can you explain a little bit about kind of evaluation of key impact pathways, outputs and outcomes in the proposals, and what those terms actually mean from a Commission perspective?
Yeah, so first of all, glad to be here. Apologies for the calendar clash, but it's what it is, you know, we all have this. Yeah, I'll try to be concise then, because I only have a limited amount of time. Yeah, and I'm really glad you asked your question, because I think it is really crucial to the understanding of the difference between Horizon 2020 and Horizon Europe. And I think that's one of the questions that I had signaled to me as well. What the main difference is like the philosophy of the program, if you like. There's much more focus on what we call not only the results of the research, the outputs. In the past, they used to be talking about, you know, general impacts, long-term, very vague, let's say, broadly reaching, very difficult to demonstrate in the context of a single proposal. But it was a sort of very loose things. And then it was the direct project outputs. But it was very little in between. Huh? Now we're really targeting what's in between the longer term impacts and the direct outputs from the projects. It's the outcomes. And what does outcome mean? It's a new term that we squeezed in there. And we're talking about the users of those results, not only the results, but who is going to use it? Will it be clinicians? Will it be citizens? It all depends on the type of results that we're expecting. So you will see the topics are written in that spirit. That means also that applicants have to think really hard on how can we make the results that we produce not only published but actually usable. I think that's a new challenge, and I think if you take home that message fully, you actually already come a long way in understanding the philosophy of Horizon Europe. Okay. So we're really trying to reach out, and all this is based on extensive public consultations that we've had. Irene mentioned already R&I days. We've had also other consultations. We have also been consulting widely across the European Commission in a new way that's never been done before. And of course, those who are involved in the actual program development from all the member states know also how we're working nowadays. So we call this co-creation, and this co-creation has resulted in this stronger focus on citizens' needs and patients' needs, and really, you know, making sure that we get practical use and implementation of that.
And actually, there's a question in the Q&A, Anna, that it sort of is related to this, and it's around as a charity who want to support researchers that we fund to contribute to Horizon Europe, what role can we play in the new EU programme? So I suppose the charity sector obviously is keen to get involved. Is there a way for them to do that?
I didn't hear what sector?
A charity?
A charity.
Yeah. So how can they? I know.
Oh la la la! Now I'm thin ice. Sorry.
Sorry about that.
Right. I'm sure. I mean, it's a generally very open program. I think I need to revert to those who follow more. This is an unusual.
I mean, I think in terms of the citizen engagement piece, the Commission have been very clear that they want to see a diversity of people within the programme. I mean, in Ireland to date, we've seen a number of charities do extremely well in the programme. It's something we want to encourage. It's something that the Department of Higher Education and Research are very much looking to expand and engage with in terms of the success of Innovation 2020. And I know Martha and Kay have been engaging with the health charitable sector in Ireland to see what opportunities there are there for them to align. And then in addition to that, I know in coming weeks, I'm speaking with the Wheel, which is the Federation of Irish Charities, to see what other opportunities we can identify. So when we talk about citizen engagement, it's about everybody that it can contribute and meet the criteria.
Yeah.
So I might come in there, Maura, if that's
sure,
okay.
oh, absolutely, Marta, absolutely.
I'm also the state representative for the Innovative Health Initiative, and I know the predecessor IMI, they have actually mapped out all of the charity groups across Europe in all different disease areas. They asked us as state representatives to feed into that, and they're very, very keen for patient group and patient engagement in research projects. And if you look at some of the projects as well, they specifically ask for patient engagement with you know, and engagement with research organizations and charities. So I think it's a case of looking through the programs and being familiar with them, and I can give you some more information on it. I think the IHI are about to launch some sort of website or resource that kind of maps out all the different things. So you can give me a buzz or email me, and I'll keep you up to date on that if you're the charity group in question.
Okay. And I mean, I'll leave it up to whoever wants to take this question on, but it's what would be the best opportunities for an individual professional who's not within a research group to get involved? Possibly, yeah.
Brokerage event, possibly.
Yes, yeah.
Now, I have to think here now, we have the info day, we have on the 25th of May, that's fixed now, and the brokerage event is on the 26th of May. That's an opportunity if you're looking for new types of collaborative partners. But I would like to say also, underline really, to be, for example, a social scientist, and in the health research context, it would be absolutely wonderful as an asset for the consortium. So we're looking, as you already emphasized, for diversity in much more than before. And we were looking for that before, but now we're really pushing for it. Yeah.
Indeed. Question for you, Marta. For SMEs, what's the best place to go to find other partners or other research groups to collaborate on an application? They mentioned specifically for the EIC pathway, but obviously I think SMEs are going to be looking much broader than that. So again, is it come talk to the national contact points?
Yeah, we can help in that regard. I think the thing with the EIC is to look at what are the what calls you're going into. As Garrett said, with the EIC Pathfinder challenges that are specifically related to health, you don't need as many partners as you think you do. So in the traditional Pathfinder, you need 3 member states and independent legal entities. Yeah. But with the EIC, for the challenges, in the case of cell and gene therapies, you can go in as a single entity if justified, or you could have another partner that could be an Irish partner or an Irish academic. So you just need to look at it in more detail. But I think it's just come and talk to us, and we can find out, we can try and help you navigate that. And also, when the calls launch and all the Pacific calls go onto their own page on the Funding and Tender website, there is an option there to express an interest in that particular topic and call, and put up your profile underneath that call for all any kind of interest you have, whether you're leading or coordinating, or whether you want to join in some activity there. You might get contacted then. So, and that's probably the best way to do it. But
I think that's really, Martha's point there is really important. I mean, you have to engage with events. You have to get to know people. You've got to build your consortia. And even, we ran a Green Deal event in Q4 last year. There were over 2,000 marketplace applications, as we call them. And we know by the website, it's still being used as a reference point where people are going back to look for people now for calls in particular areas. So, in this virtual world we live in, it's easier in some way, but not in others, as we know this morning. But it is a reality. Go to events and put your profile up there and be articulate and, say, find partners.
Yeah. And I'll because I'm very conscious that you have to leave. There's a question here about that the calls as they're set at the moment seem to be very technology orientated, and I suppose what they're wondering is, are there areas which focus more on community or adapting services, let's say into the health system or whatever?
I'm surprised that they're technology oriented. I think we try to really make them not sound so much. It depends on how you read and who is reading what's your starting point is. It's very difficult to answer that question, actually. I didn't have that same feeling about it. I have given you in some of context now, also an answer on the UK participation. There's a very recent good document just to say UK can participate. Huh? Okay, there's no difference. And there was also earlier a question by somebody I put in the chat box on the US participation.
Yes.
Right?
Yes.
So that these things remain as before, essentially.
Okay.
Yeah?
So
the
there
only
hasn't been a change.
exception I would say for the US would be the currently open what we call the emergency call on COVID. That where US is not. They can participate but not be funded.
Okay. And there is, I'm sorry, I'm laughing about this one because I think every event I've ever gone to, people always complain about the length of the applications. And they're saying that, you know, there was talk about kind of limiting the page numbers for Horizon Europe applications, but it seems to be running at least 70 pages, or just on the work program. And I guess, has there been any effort made to reduce the length of the application forms?
I think Patricia wants to take that one.
Yes. I can take that if you wish.
So Martha,
so there's different lengths of applications depending on what you are. For an RIA, it's 45, I think, K, isn't it? CSA is 30, 70 for a co-fund. So there's quite a restriction on that, and it's a very strict restriction, so that any excess pages will be stripped off and they won't be going forward to the experts. So you have to master the craft of fitting your context into 45 pages. The details of this is included in the general annex. Okay, so I can give you a copy of that as it is today. It's just a draft, so that'll give you an idea of kind of basically how that criteria for evaluation is broken down, and also those page numbers as well. So if you want to just ping me an email, I'll send you on the general annex.
So
and for the two-stage, sorry, Maura, for the two-stage application, the first stage now has been reduced to 10 pages. So that is quite a short application.
What was it Oscar Wilde said? You know, forgive me for my letter is so long, I hadn't time to make it shorter. So some 10 pages can be just as challenging as a 70-page document. But that's good to hear, actually, because I mean, you often hear people complaining about these things. Kate, can I just ask you, because we've had chats a little bit about this, and I have to admit I still haven't quite mastered this. What is a mission?
What is a mission?
How do they differ from a mission? Anybody, Anna? I don't.
It's like going to the Moonshot events. They called it the beginning. It was based on an analysis report made by Professor Masukatu when we developed the initial proposal for Horizon Europe. And the idea was, this comes back from when President Kennedy at the time said, you know, I'd like to have landed on the moon within 10 years. And actually it did happen in 8 years, and the mission was completed. So it is, if you think about, you know, a very specific objective. That is time limited, that it is extremely ambitious, and it will engage, take whatever it takes to reach there. That's essentially, in a nutshell, what it's all about. And now they can agree or disagree whether the topics that are now in the 5 missions, whether they lend themselves perfectly for that or not. That is for you to judge. But for example, the one that's closest to us, the cancer mission, they are very, very busy on working out how to engage so broadly in a way that, you know, takes engage and get and take whatever it takes to whatever it's needed to get there to your objectives that you state out. So so that's not so straightforward to do that, because it's a new way of working. We're used to working with, you know, in our silos of research, innovation, or whatever. So this is really exactly like that.
And so
it actually engages also across the different director generals of the commission. From take cancer, you talk about pollution, environment, you talk about the santé on public health, and so on. The various programs are interconnected, etc. So it's quite complex to work like that. So hopefully we will have a success on this. But I know there was a question posed earlier whether there are funding opportunities, and yes, of course there will be once there is an agreement on the missions. For the moment, what we have the Europe Beating Cancer Action Plan in santé, and this is what we're supporting and then preparing for the mission. So there's a little bit of I would say extra time needed for this process. Yes.
And so if that's the case, then, so the missions essentially will have their own budget. Am I correct in that? Or how do they align with the normal funding calls, let's say?
Oh, yeah, there is a already decided, like also for the partnerships, there is a maximum budget and for the missions as well. So that depends also on the funding year, how you spread over the years. You cannot take, account the whole mission in a single year, because then there's nothing else for anything else to do. So,
absolutely.
So now that it's, we thought we would be able to go out with the cancer mission earlier, and it would have taken a chunk, but not. It does not. There will be a delay, so it will impact differently.
Okay,
and then we had new things. I mean, okay, the cancer mission is one thing, but actually the one that really shook the castle more than anything else is the COVID. The pandemic, where we've had to raise money, issue additional calls that were not foreseen, and we're in this now, this roller coaster with, we are in the third expression of interest with fresh money, right? Trying to find in different corners. So I think this has impacted even more in a way, although it is relatively small money. But if you take it all together, also EIC were there, ERC, there are so many. The IMI have contributed to the actions that we do, and they're very significant. They're very important actions that are supposed to deliver at short term, and they're also, which is new, and I think that's an important message also to pass, they're expected to collaborate between them, these projects. We've done that already on an experimental basis in the environment and health field. Well, in the past, in the endocrine disruptor, in the exposome, we call them clusters. It's not the best word because it's cluster, but networks of projects, if you so like. And I think this is an important message also, that you could look for that type of collaborations between projects funded either under the same topic or even different topics in different clusters of Horizon Europe. That's very welcome if you're able to sort it out with timing and so on. Yeah,
I suppose it'll take us all a bit of time just to get our heads around the greatness and largeness and ambitiousness of all of this. Now, so I think we don't have any more questions. Oh, now we see there's one more, and I think Emily. So part of the call requires taking into account the diverse healthcare landscape across the European Union and associated countries. Does this mean something more than having a range of participation across different countries? Is it about building a common agenda, a common competence? Kay, maybe I'll give that much as a last question.
Yeah, it's important to look across all of Europe as to where you can carry out the research and find the most, the correct partners, and to make sure that you're covering the different areas, and if something was, was happening in a particular area, that you take that into consideration, and also to include diverse partners as well from different countries.
But not just for the sake of it.
Not just for the sake of it, exactly. Yeah.
I think that is a message.
Yeah, definitely. And that when you're putting a consortium together, that you can justify why you have those partners, and if they can bring something to it that nobody else can bring.
Okay, so listen, I will round that up. We're nearly at, oh my goodness, we're running pretty much an hour over time today. So thank you very much, everybody, for being so patient, and thank you, Anna, for hopping in and out and facilitating us. So I'd really like to thank the speakers on the panel, Garrett Murray, Martha Cahill, Kay Duggan-Wall, and especially Anna Longross for joining us. And I will hand back now to Patricia just to close out.
Thank you. It's been a pleasure. Thank you very much.
Anna.
Thank you very much, Maura and fellow panelists. And thank you for all of those people who've participated in the programme today and who've joined and stayed with us throughout the morning. A special mention to the health team itself. I mean, I hope we've managed to give you an insight into how broad of a brief we have and how experienced we are, and how we can help you to navigate the sort of complexities of European health research so you can find a place in Horizon Europe that fits you best. I mean, the team itself are involved in lots of initiatives, and Marta mentioned there the Innovative Health Initiative. We're also involved in the Transforming Health and Care Partnership and pre-planning for 4 other EU partnerships. We're in direct contact with EU staff like Anna, and representatives from other member states. And we're aware and familiar with upcoming EU events and discussions, brokerage events, policy discussions that may be relevant and interesting for you to join. A special thanks to Kay for helping to develop the programme for today, and for our facilities and comms units who worked very hard to overcome some of the earlier technical difficulties that we had. Just to reiterate that the event has been recorded. It'll be made available on the HRB YouTube's page and linked through the horizoneurope.ie website. We will look at all of the questions that have been posed this morning and provide an FAQ document online. And we will invite you to get in touch with us directly. And we would expect over the next years that lots of you will become very familiar faces to us all. So I'll just leave you with a final slide again showing our contact details for the health research team. And goodbye for now, but hope to talk to you shortly. Thank you very much, everybody. Bye-bye.